Welcome to Health Perspective. My name is Caylah McRosen, home of the Montreal Alouettes and the Just for Laughs Comedy Festival. Our goal on Health Perspective is to educate and enlighten people to live a healthier lifestyle. And in the last couple of months, we've been talking about oral care, and today we're continuing our segment on oral care, and we're talking about periodontal disease. And I just want to mention some of the risk factors. We did talk about implants with Dr. Zichan Sheikh and Dr. Akansha Shrivastava. You can go onto our website at www.radio-shalom.ca to listen to the downloads, or you can go to my website, weekly. I have blogs daily to see what we're going to be talking about in the up and coming weeks at www.montrealhealth.net. That is my own personal website. And I did want to mention that Radio Shalom is self-supporting, and we look to donations. We are a nonprofit organization to keep the lights on, to keep the coffee going, to keep us, all the animators here on the radio, my colleagues and I, coming to you. If you want to donate, you can, again, go back to the website at radio-shalom.ca, and there's a button where you can press to donate, and that'd be greatly appreciated. And back to the topic on the table, talking about periodontal disease, and I want to mention some of the risk factors that can actually cause some periodontal disease. The risk factors, or multiple risk factors, are dental plaque, tobacco, smoking, some genetics, DNA testing, stress, medication, diabetes, hormonal variation in women, whether it be puberty, menstruation, pregnancy, menopause, or postmenopause, poor nutrition. Is it contagious? Is periodontal disease contagious, which is a very good question. One of the things are the factors that increase the likelihood that I just mentioned of periodontal disease development, as well as the severity and speed at which it may occur. Among the most are hereditary smoking, like I was saying, stress, some immunocompromising diseases, connective tissue diseases, and a previous history of periodontal disease. The primary reason to consider risk factors for periodontal disease are to understand the likelihood of its development and progression and the predictability of favorable treatment outcomes. It's important to understand the risk factors don't cause gum disease, they increase one's likelihood that they will occur. Our guest today is Dr. Kelvin Ian Afrashtehfar. Can you help me with that, Dr. Kelvin?
Yes, Afrashtehfar.
Afrashtehfar, otherwise known, we have an inside joke of calling him Dr. Kardashian. His smile is just so, he should be on the Kardashians. And he's a doctor. He's published several articles in the periodontal and restorative field for peer-reviewed dental journals. He has been invited as an editorial board member for several international journals. Currently, he's enrolled in the clinical research in the Department of Restorative Dentistry and Periodontics in McGill University, the Faculty of Dentistry. He is a fellow of the Academy of Dentistry International and a professor for the Mexican Dental Association. I want to welcome you to the show.
Thank you very much, Caylah. I really thank you for your invitation. And as well, I would like to take advantage of this time just to thank Dr. Al-Sheikh and Dr. Shrivastava, who are members of my faculty, by having such interesting interview answers related to periodontics, and they made this possible for us.
You know, one of the things that's interesting, and I do have to apologize to the dentists that are listening today, is I have neglected to bring up topics of oral health, and until I bumped into your colleagues. And it was interesting because the more I thought about it, the more I realized that whatever happens when we masticate our food and how well our oral health is maintained really is the contributing factor to other diseases that one might develop. Also, can lead to poor nutrition if your alignment is not proper, and that it's so important. That's one of the most important aspects that we neglect to take care of. It's usually the last. If we have to pay for any type of care, most Canadians will just forfeit the dental care and go for what's free.
Yeah, that's true, Caylah. Just to start with this topic that we're going to talk today, I know that you have been talking about periodontal disease and bone augmentation. I would like to just give this concept to the audience about periodontal disease. I would say that this is a type of disease that affects one or more periodontal tissues. What are the periodontal tissues? These are the ones that surround the tooth or the dental implant. That's what we have to know for the lay person. This is, I think, the way that we can put it to understand it. And also, what is a risk factor? Well, risk factors in this case, they don't cause the gum disease. They only increase the likelihood that it will occur. The primary reason to consider risk factors for this disease are to understand the likelihood of its development and progression. And this is the way, Caylah, how we can predict a favorable treatment outcome.
So if we're looking at, I was even looking at hormonal variations in women. It seems like women have a greater predisposition to develop periodontal disease if we're looking at puberty, menstruation, pregnancy, and menopause.
Yeah, that's true. Women, they have many advantages just because being women. Let's talk about physiology, but also there are some disadvantages, as we would say that these hormonal variations, they are going to occur during pregnancy till menopause, and they're going to increase, as you said, the inflammation. This happens since puberty, because they are going to experience an increased level of sex hormones. These hormones, we know, progesterone and estrogen, cause increase in blood circulation, and this is going to affect the gums. This also may increase the gums' sensitivity and lead to a greater reaction to any irritation, including, the food particles and plaque. So during puberty, the gums may become swollen, turn red, and feel tender. And there's also some variations that they are going to occur later in menstruation. You can see some patients that they would come to the clinic, and occasionally some women experience menstruation gingivitis. And this is very interesting because it's a condition that may experience bleeding gums, bright red and swollen gums, and sores on the inside of the cheek. So this kind of gingivitis typically occurs right before a woman's period and clears up once her period has started. So this is concerning for many women who they don't know really why it's happening, and they are having like the best technique to brush their teeth. They are flossing, they are using the mouth rinse, and still they go over this problem. So this is something that has to be put out there, because sometimes when we are not with the information, we might get concerned. And when we get concerned, Caylah, as you know, this is going to bring other kind of problems for us.
Now, can you say that before we go into the signs and symptoms of periodontal inflammation, which we all see as like the beefy gums, but maybe you can give a little bit more, more detail. When you look at the menstruation, wouldn't that tie in with stress? Because every month a woman is stressed out in the sense that even the menstrual cycle will bring about a stress on the body. And so, is it really the menstrual period? Is it the hormones, or is it the stress that causes on somebody that causes the outbreak of this periodontal disease, the inflammation, the bleeding gums, and their predisposition to developing this disease?
Okay, as I said, there's an hormonal variation, and this is going to be the progesterone and estrogen that they are produced during the month cycle. There's like different levels of these hormones produced, and these are the ones that mainly are causing it. But as well, you said something very interesting. You said about the stress. And it's proven, in studies that stress is linked to many serious conditions, such as hypertension, cancer, and numerous oral health problems. So we could say, that stress is by itself is a risk factor. So when you combine it with having any of the conditions we have mentioned, Also, we are going to have clenching sometimes, and we will not notice when we are clenching or when we are grinding our teeth. Usually, our partner, if we have a partner and he's the one or she's the one who is going to notice if we are clenching and grinding our teeth, because this is going to put excess force on the supporting tissues of the teeth, and obviously it could speed up the rate at which these periodontal tissues are being destroyed.
And usually they'll notice because it usually happens at night.
Yeah, usually it happens at night, and for example, for the single people, it's also very difficult to know. But still, there's some people that they might wake up with some headache, even with some sore muscles of the face, like the masseter. So these are indicators that we are grinding or clenching our teeth.
And also probably the thinning of the teeth at the back of the mouth.
Yeah, for sure. Also, there's a situation with the restorative dentistry. When it's performed correctly, it's able to function as it was before. But when the restorations, they are not placed correctly, or when they are having some kind of modification and they have to be renewed, it's when we'll have those kind of problems, as you said, Caylah, and then we'll have some TMJ problems even.
Temporal mandibular joint. That's what
for
it's.
Sure, Caylah.
That's the short. That's the long version of TMJ, right?
Yeah, that's correct, Caylah.
All right. We're going to go to break, and when we come back, I'm going to get you to talk about the periodontal gum disease, the signs and symptoms that we can, that we should be tuned into, just to give us a heads up that, we're developing this and what we can do. We'll be right back.